Thrombophlebitis is a medical condition that involves the inflammation of a vein. This inflammation is typically caused by a blood clot, also known as a thrombus. This condition most commonly occurs in the legs, but it can also affect veins in the arms, neck, or other parts of the body. Veins are blood vessels responsible for carrying blood back to the heart. When a blood clot forms in a vein, it can partially or completely block blood flow. This blockage leads to inflammation and the various symptoms associated with thrombophlebitis. Thrombophlebitis can range in severity from a mild annoyance to a serious medical condition. It's crucial to understand the different types of thrombophlebitis and their potential complications. Early detection and treatment are key to preventing complications and ensuring a positive outcome. There are two main types of thrombophlebitis: superficial thrombophlebitis and deep vein thrombosis, also known as DVT. While both involve blood clots and inflammation, they differ in their location and potential complications. Superficial thrombophlebitis affects veins close to the skin's surface. It's often caused by a minor injury, an intravenous catheter, or varicose veins. Symptoms are usually mild and localized to the affected area. Deep vein thrombosis, or DVT, is a more serious condition involving clots in larger, deeper veins, usually in the legs. DVT can cause significant pain and swelling. More concerning is the potential for the clot to break free and travel through the bloodstream. If a clot travels to the lungs, it can cause a pulmonary embolism, a life-threatening condition. Recognizing the signs and symptoms of both superficial thrombophlebitis and DVT is crucial for seeking timely medical attention and preventing serious complications. Recognizing the symptoms of thrombophlebitis is crucial for early diagnosis and treatment. The symptoms can vary depending on the location and severity of the condition. However, common signs to watch out for include redness, where the affected area of the skin may appear red or discolored; warmth, where the skin surrounding the affected vein may feel warm to the touch; swelling, you may notice swelling in the area around the inflamed vein; pain or tenderness along the vein, which may worsen with pressure or movement; and a hard vein, where the affected vein may feel hard or cord-like under the skin. If you experience any of these symptoms, it's essential to consult with a healthcare professional promptly. While superficial thrombophlebitis is usually not serious, it's essential to rule out DVT, which requires immediate medical attention. Understanding the causes of thrombophlebitis can help individuals take steps to reduce their risk of developing this condition. Several factors can contribute to the formation of blood clots, including damage to the lining of a vein, such as from an injury, surgery, or intravenous catheter insertion. Prolonged periods of sitting or lying down, such as during long flights or bed rest, can slow blood flow and increase the risk of clots. Certain inherited or acquired conditions can make the blood more likely to clot. Some medical conditions, such as cancer, heart failure, and inflammatory bowel disease, can increase the risk of thrombophlebitis. Smoking damages blood vessels and increases the blood's clotting tendency. Certain hormone therapies, like birth control pills or hormone replacement therapy, can slightly increase the risk of blood clots. It's important to discuss your medical history and any risk factors with your doctor, especially if you experience any symptoms of thrombophlebitis. Diagnosing thrombophlebitis typically involves a combination of a physical exam and diagnostic tests. Your doctor will begin by taking a detailed medical history and performing a physical examination. The doctor will examine the affected area for signs of inflammation, such as redness, swelling, and tenderness. They may also feel the vein to check for hardness or cord-like texture. An ultrasound uses sound waves to create images of the veins and blood flow. It can help identify blood clots and assess the extent of the inflammation. Blood tests, such as a D-dimer test, can detect substances in the blood that indicate clotting. In some cases, a venogram may be necessary. This imaging test involves injecting a contrast dye into the vein to obtain a detailed X-ray image of the blood vessels. These diagnostic tools help healthcare professionals confirm the diagnosis and determine the appropriate course of treatment. The treatment for thrombophlebitis aims to reduce symptoms, prevent the clot from growing or breaking off, and lower the risk of complications. Treatment options may vary depending on the type and severity of the condition. Over-the-counter or prescription anti-inflammatory medications can help reduce pain, swelling, and inflammation. If you have DVT, your doctor may prescribe blood thinners, also known as anticoagulants, to prevent the clot from growing and reduce the risk of it traveling to the lungs. Wearing compression stockings can help improve blood flow and reduce swelling in the legs. Keeping the affected leg elevated can also help reduce swelling. Applying warm compresses to the affected area can provide relief from pain and discomfort. In rare cases, if other treatments are ineffective or the clot is very large, surgery may be necessary to remove the clot or repair the vein. It's crucial to follow your doctor's recommendations and complete the full course of treatment to prevent recurrence and long-term complications.